Nora Speaks is a weekly podcast that tugs at the soul and consciousness of the Black community. With show topics such as youth empowerment, education, women's impact, and civic engagement, Nora Speaks challenges the listener to not only join the movement, but be the movement. On the show, you'll learn from insightful guests who have demonstrated capacity in these fields and more, and I'm your host, Nora Muhammad. Welcome to the show. Welcome to another episode of the Nora Speaks podcast, and I am your host, Nora Muhammad. It is such a privilege and a pleasure and a wonderful opportunity to be with you today in another edition of the Nora Speaks podcast. I always say it's a privilege because for you to lend me your ear for the time that you do, for you to come back week after week, listen and consume this content, it really does mean so much to me because it is you who I'm producing this content for. I have my people in mind. As I do each and every episode, I have my people in mind. I have the needs of my people in mind. Before I go live and hit record on the mic, I ask God, Allah, to guide my words, to make what I say precise so that the audience can receive it with the intention in which I am producing this content, that I am clear, and that the audience also can feel the pulse of my heart in the information that I share. As I say often, this is not an exercise in vanity, the Nora Speaks podcast. No. In fact, it's a responsibility that I know that I have to my people so that we can carve out success for ourselves, so that we can carve out a future for ourselves, so that we can improve our outcomes, improve our current reality, so that we can raise strong and healthy children, so that we can improve our communities, starting with our households, beginning first with ourselves. So it is with the intention to really uplift the Black community, which is my community. And in uplifting the Black community, all communities are therefore uplifted. And so I really do appreciate you. I appreciate you coming back. I appreciate you listening. I appreciate you sharing. I appreciate the support, the love, the shout outs that I get on social media, the emails that I receive. It really does give me joy to know that the project that I started over 2 years ago with this podcast continues to resonate, and it continues to meet the need of my community. And, you know, we are very in a very strange time right now. We're still dealing with the worldwide pandemic of COVID-19. We're dealing with sheltering in place, staying home for those who are non-essential workers. We're dealing with unemployment. Many of us, we are wondering, will our businesses survive? The stress in the economy. Some are home and wondering, will they be able to find another job? Will their employer bring them back? What can our children expect in terms of education? What can we expect for them in their educational system? For students who are going to be enrolling in colleges, what is that going to look like for them? So we are in really uncharted territory for so many of us. We don't know what's going to happen next in many cases. But I want us to think about and focus on those aspects of our lives that we can control, that we do have immediate authority over, because controlling what we can reduce our anxiety around this. You know, whether that's you planning out your day, scheduling your meal, finding the recipe that you're going to use to make this evening's dinner, the game nights that you're having with your family, shucks, what you're going to watch on Netflix, thinking about those things that we have control over and that we have authority over, I think is a great way for us um, to rest our thoughts on. We are watching the news, we're watching the press conferences, we're on social media, and there's so many social media gurus that's telling us, what herbs to take, what oils to use. Their own medical experts, and so there's a lot of information that's coming at us, and it can be overwhelming, it can be confusing. So let's filter what we are inputting. Let's filter what we are consuming. Certainly stay up to date on what's happening in your state. And you don't have to watch the press conference. You can go to your state's website. You can go to your governor's Facebook page or social media account. You can read the local newspaper to kind of find out what the governor, what your county officials, what your mayor has reported. And then I do encourage you to disconnect from all of these sources that are doing a good job of increasing our anxiety. And I heard a term this morning called panic porn, where in the media, the news, they are creating anxiety in us, and it's as if it is their goal, based on the headlines, based on the actual graphics that they use when they're talking about COVID-19 or the coronavirus. I mean, you look at the graphics, it looks like the same thing that you might see in your child's video game or in a horror movie or a sci-fi film. The graphics, the depictions of the disease, it really is created in a way, it's like a horror movie, the way that they're designing this. So just realize that media does have an impact on our mentality. It has an impact on our stress level, what we're consuming. So consume that which is going to give you the information that you need, and then disconnect when necessary. So in this episode, I do want to share 4 ways or 4 things that we can do so that we can stay healthy, so that we can reduce our vulnerability to this and other diseases. And I got this information directly from Dr. Terry Mason. Dr. Mason is the former commissioner of health for the city of Chicago, and he's held other very prominent, important positions in the city of Chicago and the state of Illinois regarding public health. And Dr. Mason was recently a guest on CROE-TV, and I will make sure that I share the link to the interview in the show notes so that you can go back and watch this episode for yourself. But it was such important information that Dr. Mason shares, and Dr. Mason always shares great information no matter what he's speaking about regarding our health. And, there's so few people that we can trust. There's so few people who are giving us information that we find and can believe are credible sources. So for many of us in the Black community, we have a certain distrust. We have a certain suspicion with medical providers in this country, and understandably so, considering the history of this country with Black people, with disenfranchisement, with experimentation, speaking about the Tuskegee experiments, speaking about, our sister Henrietta Lacks and them taking her cancer cells and using them, not compensating her family nor receiving consent to do so. And so for Black people in America, we have a distrust. We have a disconnect, and there's a deep divide. And so it's important that we have people like Dr. Mason who can give us information and be someone that we can trust. Why should we trust Dr. Mason? Well, Dr. Mason is a Black man. Dr. Mason is someone who's practiced medicine and began his practice after being inspired by the Honorable Elijah Muhammad, who talked to us about having our own medical centers, our own medical facilities, so that we can get the care that we need from medical providers who actually care about us. So it is with that Dr. Mason was inspired, and he continues to serve the community as a medical provider and sharing information. He goes to churches, he goes to public meetings so that our people can get information firsthand. And another thing that's so important about Dr. Mason and his approach, and the approach of others who are in our community, coming from a medical background, treating and seeing our people, is understanding our people. The cultural competence that one must have to adequately treat our people so that our people can get information that they can understand, that they can digest without too much misunderstanding, knowing what's important to our people, knowing the terms that we use when we're talking about medical conditions. And, Dr. Mason is someone that we can sit down with and speak about medical issues and be comfortable doing so. He's a trusted source. So Dr. Mason was on recently, I believe last week, and he talked about what we can do to stay healthy, specifically talking about during this COVID-19, the coronavirus pandemic, but also just in general. So I want to share that with you. And again, I will make sure I include the link in the show notes so that you can hear this information and more, and that you can also be connected to CROE-TV so that you can have a source of media that's independent, that is not corporate sponsored or corporate created, so that you have a connection to an independent Black media source that has us in mind. So let's get to the 4 steps to keep us healthy. The first thing Dr. Mason said is that we have to manage our stress. It is so important that we manage our stress. And when our stress levels are increased, especially on a chronic basis, it's one thing to have a stressful moment, but to have a lifestyle of stress, whatever is causing the stress, let's talk about what the stress can do to our bodies. So stress can, as we know that the stress hormone is the hormone cortisol. Cortisol will increase our heart rate. Cortisol will constrict our blood vessels. Cortisol will increase our blood glucose levels. Now, this is good if we're talking about a fight or flight or freeze scenario, because we have to be, our body is prepared to respond, to defend itself, to flee if necessary. So that's necessary in an urgent or emergent situation. But to have a condition where the cortisol is in our bloodstream on a chronic basis, remember, increased blood sugar, constricting our blood vessels, and raising our blood pressure and our heart rate. So stress will weaken our immune system. Stress can lead to cardiovascular disease and high blood pressure. Stress can give us digestive issues. Stress can increase our blood sugar. So we're talking about diseases that are stress related, such as diabetes, such as stroke, heart disease, or even a heart attack. So it is so important that whatever is causing our stress, identify it and find ways to manage it. So we may not easily be able to change the condition in our lives that is actually creating the stress. And when we can, then we should make changes that are appropriate. But when we cannot, it is important that we manage our stress. And there's so many things that we can do actively to bring our stress levels down. And I'll talk about that in another episode. And to get more information on this, specifically just talking about stress, I refer you to episode 63 of the Nora Speaks podcast, where I talked about how stress impacts our bodies. But Dr. Mason says that we have to manage our stress. Stress will interrupt and can interrupt sleep. Dr. Mason says, number two, after managing stress, we have to sleep. We have to give our bodies an opportunity to rest, to recover, because when we do not get enough sleep, that too impacts our immune system. And we know that right now we want to have a strong and immune response system as possible. So we have to manage our stress. We have to make sure that we are getting rest. And I'll say that the hype of the media, the persistence of the media induces anxiety, and that increased anxiety also will interrupt our sleep. So poor sleep can lead to inflammation. It can lead to high blood pressure. It can lead to insulin resistance, weight gain, cardiovascular disease, high levels of cortisol. Again, we talked about that. So it is important that we get the proper sleep and we get the proper rest. And I've read where, most people, 7 to 8 hours. Some people's bodies and their systems are different. Some people thrive on 5 hours of sleep. Whatever it is that you need and where you can function, where your mind is clear, where you're not creating mood issues by having a lack of sleep, where you're not having memory problems because of lack of sleep, get the rest that is necessary and appropriate for your body. To do that, we may need to turn the television off. We may need to put our cell phones down, silence our cell phones, create the conditions in our bedrooms that promote sleep, get thick curtains, get bed linens that are comfortable, that are luxurious, that make you feel good. If you need to do some breathing exercises before it's time for you to go to sleep. A lot of people say, I just can't turn my mind off. Well, there are applications and techniques that you can do to manage your stress, to allow you to get a good night's sleep. And as we move on in these actions, these 4 steps that Dr. Mason gave us to help us stay healthy, this too can help us get proper sleep. So the next one is drink water. Make sure that we are getting enough water every single day. Now, all of our body's functions, all of our cells need water. And I'm not just talking about make sure you drink something. Dr. Mason specifically said that we have to drink water. So that we have to get water. This is not to say that you have to have a gallon-sized bottle with you of water so that you can get, 128 ounces, 64 ounces, 96 ounces of water. We should get our water not just from drinking it from glasses, but also from eating it from fresh fruits and vegetables. Fruit has so much water. Vegetables have so much water inside of them. So if we're eating fresh fruits and fresh vegetables, then we're also getting water if we're also drinking it. So it's not just for us to, like I said, walk around with a bottle, but do make a concerted effort and get into a habit of drinking water. And I know some people say that they don't like the taste of water, which is, it's odd to me, but some people don't like the taste of water. You can squeeze lemon in your water. You can put frozen blueberries or strawberries in your water to give it flavor. But drink water, not soda, not juices. Drink water. So water is good for sleep. Water is, now I'm not saying drink 50 ounces right before bed, because that's going to interrupt your sleep because you're going to have to get up and go to the bathroom. But water helps our body function adequately. And when our body is functioning adequately, when there's not stress inside of the body because we're not giving it what it needs, then our body can function like it's supposed to. So water is good for bowel motility, meaning going to the bathroom regularly. Water is good for our joint health, right? Because our cartilage is made up of water. So there's so much that is good for us in water, by drinking water, your skin, your hair, your fingernails, our bodies, our organs, our systems need water. And so we have to make sure we're giving our body what it needs so that it can properly defend us when it is exposed to a virus or to a bacteria. So the fourth action that Dr. Mason said that we should employ to maintain our health is to eat plenty of fruits and vegetables. Dr. Mason said that fruits and vegetables, especially the dark ones, they have antioxidants that protects our blood vessels. And if we don't give our body what it needs to defend us, it's not going to be able to. So he advises us to eat fresh fruits, to eat fresh vegetables, especially the deeply colored ones, organic if possible, but even not, the non-organic fruit and vegetables are better than having none at all. And right now, I know, with this virus, a lot of people are talking about getting the vitamin C and, taking vitamin C capsules or getting vitamin C supplements from other sources. And we kind of go in the wrong direction by looking to supplements first as the source to receive these essential nutrients and vitamins, when we are skipping over the actual natural source, which is the fruits and the vegetables. So if we are looking for vitamin C, then eat the foods that have vitamin C, like apples, like strawberries, like citrus fruits. And when we take these nutrients from their original source, which is the food that we can consume, then it is more likely that those nutrients are going to be absorbed and used by the body. Sometimes we just make very expensive urine when we buy these over-the-counter supplements and herbs, and we take them. I mean, there's so much that we have to understand. So, for example, people want to take calcium supplements, right? Well, you need vitamin D for our bodies to absorb calcium. If you don't have vitamin D, your body is not going to receive the calcium that it needs, and then you can have a problem with your bone density and your bone health. So we may have to make sure that we're getting vitamin D from the appropriate sources, so that when we are consuming the calcium, then that combination will allow us to receive the calcium. So, I know, there's so many vitamin shops and nutrition centers, and you think that the garden is the best nutrition center that we've ever been given. We should return to the garden for our health. So that means you may not have your own personal garden. It'd be great if you started one. But remember, fruit and vegetables are our natural source of supplements. They're our natural source of nutrients. And they are the sources that are the most likely to ensure our bodies are receiving them and absorbing them and using them. So just going back and reviewing our 7 steps to maintain our health, make sure that we are managing our stress. Let's make sure we're getting proper rest. We're getting enough sleep every day. Let's make sure we're drinking plenty of water and that we are eating fruits and vegetables. And that, if we just do these simple things, then we can maintain health. And, there's so many diets and there's so many systems and there's so many plans, and if you need a plan and you have a plan and that plan works for you, that's great. But we don't need to make this overly complex to maintain our health. Drinking water, it's natural. Eating fruits and vegetables, it's natural. Getting rest, that's natural. And certainly managing that which produces anxiety and stress, and then managing the anxiety and stress if we have it by, breathing techniques, by meditation, doing exercises and working out or taking a walk. All of these things can reduce our stress. So let's think about how we can stay healthy, not just so that we can maintain a strong immune system so that we don't get sickened by the coronavirus or COVID-19. I mean, viruses and bacteria, it's all around us. They're all around us all the time. What we need is a strong and healthy immune response, immune system, so that when we are in contact or around these viruses, our bodies are strong enough and healthy enough to defend us, to defend itself from these diseases and the subsequent illnesses that these diseases bring. We don't need to run to the doctor to get a pill. That pill is going to create a condition that you might need a second pill, and then that pill may create a condition that you might need a third pill. There's a way that we can protect our health and live long and live healthy and feel good doing it by just implementing these 4 simple actions. Again, I'm going to include the link in the show notes for this episode so that you can familiarize yourself with Dr. Mason. You can familiarize yourself with CROE-TV, that independent media source that is bringing us information for us and producing content with us in mind, just like you find here on the Nora Speaks podcast. I want to thank you so much for listening to this episode of the Nora Speaks podcast. And until next time, stay in peace. Thank you for listening to another episode of the Nora Speaks podcast. Be on the lookout for a new episode coming at you fresh next week. And as always, if you want to learn more about me and the work that I do, visit my website, norahmuhammad.com. Or if you have a listener question, email me at info@noraspeaks.com. You can also follow the Nora Speaks podcast on Facebook, Instagram, and Twitter at Nora Speaks Podcast. I'll be sure to include links in the show notes. If this show has value to you, please subscribe, rate, and review, and share it with family and friends. And be sure to check out previous episodes. And remember, don't just join the movement, be the movement. Stay in peace.